Many of you I know will be familiar with the Time to Change campaign. It's a campaign run by, led by ourselves at Mind and our partners at Rethink Mental Illness, and it has already helped and supported in a improvement in public attitudes, general public attitudes around mental health, and a reduction in reported levels of discrimination. But sitting underneath that piece of work, which you're probably quite familiar with because you will have seen some of that, has been quite a lot of work working with children and young people. And the work that's been done has been done in the main in the West Midlands and in Kent. This has been absolutely led and driven by young people themselves. Key part of this also has been the work of around thinking about the power, and in this case the positive power of social media. You will see a lot more about this campaign when it launches in November, but suffice to say that the work that's been done to date is already showing good quality improvement in outcomes in terms of knowledge, attitudes and behaviour, and also empowerment for those people, young people with their own experiences of mental health problems who are active participants in these programmes. So this is having a kind of double whammy effect, if you like. And we've heard a lot about the role of the statutory sector in this agenda, and I think that's hugely important. But I think this is also about the role of schools, it's about voluntary sector, it's about community groups, it's about community organisations, and it's also about professional experts. We've been doing some work in 3 parts of the country thinking about how do you raise awareness and build resilience amongst young people in schools in a kind of fairly broad-based way. Again, early days, but early impressions are that this is going well. So I think part of our challenge from Future in Mind is to continue to commit to building a really powerful evidence base around what works. I just briefly want to mention also a new partnership with the Scouts Association, and those young people, building on a much bigger survey that that Scouts and Explorers had initiated, identified mental health and well-being as a top 5 issue. Now I have to say this is not an unusual state of play. In surveys of young people themselves are spontaneously identifying mental health and well-being as a really key priority issue for them. So the power here is in the young people. The power here is in the demand and the drive and the openness and the increased awareness to tackle this issue. And we all have to really get out the way and create the space for that power to come through and be unleashed. So we're really excited that the Million Hands programme is already taking place. 4,000 Scout and Explorer groups and Cubs and Beavers have registered, representing around 150,000 people. This was launched 2 weeks ago. Now the Crisis Care Concordat, which is a big initiative amongst many organisations, where every locality has a clear crisis care pathway for anyone experiencing crisis care. But some of the biggest challenges have been around how you help and support young people in those pathways. So it's all very well eliminating use of police cells, but is there the appropriate facility for those young people in the right kind of locality if that is required? And there are still some quite big challenges around achieving that for our young people who are perhaps in the most crisis and need the greatest support. But I also mention this because I think this is a bit of a blueprint for what I hope will happen with the Children and Young People's plans that we're going to see in the next few months. Because I think there is an importance about giving localities the freedom to be able to design and create their own plans. There are different priorities in your communities. There are different areas that need addressing, different issues that need addressing. But I think also we can learn hugely from those plans and learn from each other as those plans are developed. So I'm hopeful that in the next stages these plans will be visible so that people can learn, everyone can learn from the work that's going on at a local level, because you can absolutely be sure that the answers, the solutions are in those local communities working with each other in the right kind of way. This is the opportunity to innovate, do things differently, and bring together local communities to achieve that. And you've seen rafts of initiatives like vanguards, like multi-speciality community providers, new models of care, etc., inside the NHS. And in this area particularly, I think that is a green light to those of you who have been dying to do things differently in your local community, to get out there, get together with the key people in your communities, and make things happen. So please do go and do that as you're thinking about pulling those plans together. Thanks very much.
Excellent.